kind introduction, David. So let's talk first a little bit about the 19th Amendment. And needless to say, this was something that was of supreme importance to those of us who are women today. It laid the foundation for what I'm able to do as an elected official and provided just such a rich background for the women's movement, for women's rights, and for equality in our communities. So I always like to look back at the women who came before me. So you're seeing pictures of my great-great-grandmothers, my grandmothers, and my great-grandmothers. Not all of them, I didn't have room on the page. These were just some handy pictures I happened to have. And as I look at each of their lives, immigrants who came from, some from Sweden, some from Wales, others who were individuals who grew up in the United States, several of them who grew up in the Republic of Hawaii and then the territory of Hawaii, ultimately becoming the state of Hawaii. They were very influential women, of course, in my life and in my parents' and grandparents' lives, but also these were the women that were first given the right to vote in my family. And so I loved looking back at the history for, at the time, the territory of Hawaii. There was something called the Organic Act, which prohibited giving women the right to vote until the rest of the United States received it. And so ultimately, Hawaii women did not receive it until we passed the 19th Amendment. And that little star in the corner there is actually a feather star. And it was created by some wonderful craftswomen of Hawaii who sent it back to Washington, D.C. to encourage the passage of the 19th Amendment. Now, a lot of my ancestors were in Utah. They were early Mormon pioneers who had crossed the plains. And a lot of people are unaware that Utah was actually the second territory or even state to give women the right to vote back in 1879. And then, due to a funny thing called polygamy and other things, there was something called the Edmund-Tucker Act, which was passed in 1887, which severely restricted the rights of the territory of Utah. Women's right to vote at that time was rescinded. Some of the politics, there was apparently a concern that women would tend to vote for things that the men were supporting and that they weren't going to support other parts of the United States. So women were essentially stripped of their right to vote at that time. And then this was restored when Utah did enter statehood in the 1890s. They were once again restored the right to vote. And I could certainly talk about some of these women who were back here at the time from back east, who came back to really help women pass the, once again, the right to vote. And what we saw is in California, a little bit of a different twist. And so in 1896, Californians rejected giving women the right to vote. California had really wanted to be the fourth star, so to speak, giving women this right, following Wyoming, Utah, and Colorado. And thanks to Beverly Lane, who some of you may know, who sits on the East Bay Regional Park District Board and is a former mayor of Danville and is a curator of the Little Museum of the San Ramon Valley. She provided some of this data in an article she wrote a couple of months ago. And so interestingly, San Francisco, Alameda, Contra Costa counties all opposed giving women the right to vote. Contra Costa, it was actually broken up with 1,638 opposed, 1,002 supported. And then you can see our communities. Alamo was a little more progressive, 27 voted yes, 25 no. Danville, 45 voted yes, but 72 voted no. San Ramon, a little more progressive as well, 38 yes, 32 no. The Tassajara Valley, which is unincorporated Danville and San Ramon, defeated 21 yes, 29 no. And Walnut Creek, ahead of their time, 48 yes, 45 no. And so in 1911, you had a very progressive Republican legislature in California. And so it was once again put before California. Voters won by only 3,600 votes. San Francisco completely defeated it. And there was some tie with a women's temperance league. And some of the bars in San Francisco were apparently concerned that if women who were associated with this women's temperance league were given the right to vote, it might inhibit the opening and expansion of some of the bars. So here are some of the interesting, little bills that were posted, California be next in October 10th, 1911. And fortunately, at that point, California did receive the right to vote. Now, once the Western states gave women the right to vote, Southern and Eastern states lagged behind. And this was a cartoon that appeared in the magazine Puck, sort of demonstrating just how, we were trying to move eastward to get our right to vote, and race relations were also impacted because of the way certain, primarily the Blacks in the South, were being treated. And there was concern about how that would affect their right to vote. And so we found it lagging until ultimately the women pushing it forward decided we really need to just focus on a national amendment. Let's stop trying to do it state by state at this point, but let's get the national movement going. And so both the National American Women's Suffrage Association, the National Women's Party, they really changed it to this national amendment. This was one of the first protests ever in front of the White House. The silent sentinels who stood there silently, of course, in front of the White House to advocate for the passage of this amendment. And then we had the pandemic. We had the Spanish flu hit in 1918. And actually some of the main leaders of the suffrage movement became ill with the Spanish flu. There was a slowing of momentum. And I loved this quote, which we could just change the word women's suffrage to anything else in our lives right now. Everything conspires against women's suffrage. Now it's the influenza. And this was the feeling of so many women. Nevertheless, it was in fact passed. And of course, women did receive the right to vote finally in 1920. So we're going to talk, I'm going to shift into a little bit of a different pandemic. We're going to shift from, that was my segue into COVID-19. If you don't regularly go to the county's website, our health website, I'm going to really encourage that you do. And this is coronavirus.cchealth.org. Every day at 11:30 a.m., so in just a couple of minutes, you can log in, you'll get our updated numbers. And so on the homepage, you show how many cases we have in our county currently. We've had 2,026. On a future page, it shows you how many recovered. Currently, we have 26 in the hospital and 49 deaths. Unfortunately, yesterday we saw some additional deaths, and I'll talk about that in a moment. And so we have a daily count increase, and we knew that cases were going to increase as we expanded testing. And the reason we want to expand testing, of course, is so we can identify where in the community we're finding cases, and then we do contact tracing to try to identify who around those individuals who were tested might also have been exposed. As most of you I know are aware, it is possible to be completely asymptomatic while still being contagious, while having COVID. And I know there was, I think last week, for a blip, a second in time, someone say, no, that's really rare. And that was since rescinded. In fact, we do believe it is still a serious issue. And so here on this dashboard, which we call them, it shows that we've had, over 1,500 people have recovered. And then we were seeing 44 new cases. And this is just yesterday, 44 new cases. And again, with what we see, we anticipate additional cases. But what concerns us is when we start seeing the infection rate of those tested going up. And so if you go back to earlier part of the month, or even more, the end of May, our test rate was closer to about 2.5% of everyone who was tested positive. As of yesterday, 3.5% tested positive. And last week it spiked at one point to about 4.8% of those that we were testing tested positive. Now, some of that may be attributed to, we have had an outbreak in another congregate care facility where we were testing all of the patients living in that senior congregate care facility, as well as the healthcare professionals. So that could have accounted for the spike. Where we want to keep our positive 7-day average below is at least 5%. And in order to meet state guidelines, it really needs to remain below 8%. And we have some great data about the number of cases in the county. And this just shows you the first column here. It shows you the positive case count, and that's a total case count since we started back in March. Shows you the population, and the equalizer is really showing the cases per 100,000. And some areas, for example, if you go down to Orinda, it has still a fairly high case count per 100,000, and that was because they had one of the most serious outbreaks in the initial days, where we did see many cases in a congregate care facility. Right now, our concern is where you're seeing the very high case counts. If you come down here, San Pablo has approximately 554 cases per 100,000. And you compare that to Walnut Creek, which is only 104 cases, to Danville, 73 per 100,000. We're also seeing El Sobrante, a large number per 100,000, Pacheco, and Richmond. As you can see, it's very much our disadvantaged communities. It's communities where people have not had the luxury of working from home like so many of us have had that ability. It's people who have been in industries where they've had to work both to just sustain themselves, but also because the nature of their employment. And so it might be, cleaning at a hospital, an office that was a business that was allowed to be open, working in a grocery store, things that tend to be a little less paid as far as their compensation, and also areas where you might have multi-families living together in one dwelling unit. We are taking this all very seriously. We're also really looking at making sure that we have all of our materials, our orders, our advice in many different languages. And then we're working with a lot of the clinics and others out there to really try to look at what more should we be doing in these communities where we're having these outbreaks that are community spread and not associated with congregate care facilities, which of course are a very, very serious issue for us, but those are a little bit easier to address because we know where they are, we know who to test, and we can test monthly and keep track of things before they get too serious. So the hospitalization data, this one is also, as we do increased test counts, we don't expect hospitalization to go up. And so it has been a little disconcerting as we've been opening things up. Starting around Memorial Day, our hospitalization numbers went up. We were down at about 13 on average to 15 hospitalizations 2 weeks ago. Currently, we're up to 26 in the hospital. And what this number does not account for is there are approximately a dozen more Contra Costa residents who are housed in Alameda County hospitals. And that's because Kaiser Richmond, the only hospital that's open right now in West Contra Costa County, does not keep their COVID patients at their hospital. They send them over to Alta Bates or to Oakland Richmond or to Sutter hospitals there. And so we have to individually contact those hospitals to find out how many Contra Costa residents are there. Our other data is processed through the state. And so deaths are accurate per county. Tests of individuals are accurate by county because that's where the data is collected, sent to the state, and then we draw down the data from there. ICU data, and this is something when you heard in the early days flatten the curve, this is what we were really looking at. And we needed to make sure that we had the capacity. And so each of our hospitals increased their ICU capacity by adding or having in place ready beds that could be turned into ICU equipped beds. Currently in our county, we have 214 ICU beds. 93 of those are being occupied, not by COVID patients. We don't have that number on there, but in general, that just could be stroke victims, heart attacks, and whatever other medical condition somebody has, but we need to make sure that we have that capacity should we continue to see our numbers going up and have a surge. And then the other thing that we always have to look at is the ventilator capacity. And right now we've got great ventilator capacity. Only 26 ventilators out of 280 available are being used, and hopefully we'll see those numbers remain very low also. So we know COVID has been one of the primary causes of death in the US. And so we always want to look at who's getting sick in our county. And again, all of this is available on our coronavirus dashboard. But genders right now, female in our county, a little bit higher than male. Races is something that is very interesting as well. Now, we do have a big unknown of these by race, and this is only because when these tests are performed, particularly by private labs, someone is not obligated to reveal their race, and so that's why we have this unknown. But we do see that the blue shows you percent of confirmed cases. The green line shows you the percent of the county population. And so right now you can see our Asian population, we have far greater number of individuals who are of Asian descent compared to the number of individuals who actually have COVID. Similarly, it's showing the same thing for our Black population. You know, fewer percentage of Black members of the community currently have COVID or have had it than make up our population, multiple races. Right now, it's predominantly white individuals that, or actually, I'm sorry, it's not. It's also a disparity there. It's this other that we don't know and this unknown. And so where we're seeing national trends of people of color having a higher percentage, that's something where we're trying to get a little bit of more accurate information, and it's been challenging. Cases by age group. This is something that you may have seen in the media that is shifting significantly. Previous cases were showing it was more of, it was more older adults who were getting it. We're seeing more and more younger people, young adults getting it. There's lots of theories about why that may be the case. One that everyone thought, kids don't get it, don't worry about it, other than those very unique and challenging cases where there's some severe reactions. And so this just gives you a general overview of who has it. The morbidity is a little bit more significant when you look at it, and this we do have accurate data. Here you do see that in our county, the majority of people who have passed away because of COVID are white, our African-American population. We've lost approximately 3 people. Asian, it's closer to 8 people. Other, again, we have that little undefined, which we aren't able to completely track. And then the death by age group. And this is one where it's hard to make big assumptions. One, it's not a huge sampling, but you do know that the majority of individuals who have passed away are over the age of 60, certainly over 70, with the largest group being those who are 80 to 90. To date, we've only lost 1 individual in the 30 to 40 age group, and I believe this number is approximately 5 in the 50 to 60 age group. And so people often ask about, state orders versus county orders, and especially in the early days, because we were having sometimes competing orders. And so the governor essentially came up with the decision that state orders prevail unless you have a stricter county order, then it should apply. And so these are all the health orders we've issued to date, and I'm not going to go through all of them because all of you have had to live through these health orders one way or another. And we do now start sort of providing a roadmap forward. And hopefully some of you have been seeing this. And this shows we've come through all these orders. And today, of course, is the big day where hair salons, barbershops, increased religious services, changing of swimming pool capacity opened up. July 1st, we do anticipate having indoor dining and bars opening. Indoor religious services have been shifted, and because we moved them up to a sooner date. So this is slightly dated. They haven't given us the update timeline. We're seeing more limited indoor leisure. You can go back to your bowling league, pool halls, things of this, indoor museums. Hotels will be open for tourism. All of these are being done with appropriate guidelines, social distancing, and the county, while we are setting up our own timeline, we are not setting up our own guidelines. And so the state has a wealth of information on guidelines of how they should be going forward. What we don't have in our timeline yet, and our health officers are meeting together, and I'm talking about our Contra Costa health officers. In the early days, it was our Bay Area health officers making these decisions in lockstep. But our local health officers are really trying to figure out where do we put in additional personal services, such as non-therapeutic massages that aren't related to a medical condition, nail salons, eyelash, whatever, personal care you get. those are still not into the timeline. And then the schools is a significant issue. We are not dictating what the schools should do. We are working with the Contra Costa County Office of Education with Lynn Mackey, our school superintendent, to offer our guidelines. The state, Tony Thurmond, our school superintendent, has come out with guidelines. And each school district is really going to try to have to figure out how they want to implement it. Now, most of us would really like to see children back in school full time, because that is what they really need for their academic performance. They need that, I think, really for their emotional support as they move forward. And it's going to be challenging if we start having, doing the split days, partial Zoom, partial in person, particularly for working parents trying to navigate that whole childcare, but also the homework from home. Most parents didn't sign up to be teachers, and it's challenging when they're put in that role. And so this is an ongoing discussion, trying to work through it, and we're not going to make the final decision. In fact, our health officers were not in favor of closing the schools in the first place. In the early days of the pandemic, we did not think that the risk to children outweighed the benefits they had by staying in school, by having nutrition programs, by having that social support and educational support. But nevertheless, we ended up where we did, and we hope to get children back to school in the fall. This is just another chart that's on our website, just shows the reopenings to date, and these are regularly updated so people can just at a glance determine, what's happening, what's been opening. So people often ask, okay, so who's making these orders? And there was a funny article came out over the weekend, who died and made him king, that somebody gets to make these health orders. And so our Contra Costa health officer is Dr. Chris Farnitano. He was appointed the health officer by the Board of Supervisors. So we do in fact appoint him, and I've had many an angry email saying, well, you should fire him too. We don't like these orders. But nevertheless, bright gentleman, got his medical degree from Duke University. He has been a family physician, an HIV specialist with the county. He came as a resident to us in 1991. And as I put it in the left-hand bottom corner, originally our health officers really were working together to have consistent health orders for the Bay Area. And the reason for that was simply that we are one big ecosystem when it comes to jobs, transportation, transit, activities. And there was really a desire to recognize that we didn't want people going from one county to another, bringing whatever infectious disease they might have, because they might get more services in one county. And of course, we've already seen that as we saw Napa and Solano County breaking on a quicker path. A lot of people were heading up there to do those very things, have their dinner out, and those counties have had to scale back because they have seen increases. And similarly, as we see some of our numbers going up, right now, we don't plan to pause our reopenings, but it is a concern. And so the authority of the health officer comes out of the California Health and Safety Code. Essentially, it says that he can take preventive measures, or she, when you have a female health officer, which many counties do, necessary to protect, preserve the public from any public health hazard during a state of war emergency, state of emergency, or local emergency. And of course, we do have both the local and state emergencies declared. And then another section, it does say that when, in essence, when you have a pandemic, a communicable disease exists, they shall take measures as are necessary to prevent the spread of the disease or occurrence of additional cases. And so that's where the authority lies for our health officer to make these orders. He doesn't make them in a vacuum. He does still consult with the other Bay Area health officers. He has guidance from the state, and he has many doctors who are deputy health directors within our county who he is also in conversation with. They have a committee that looks at reopenings, how we move forward, and they consult with other doctors really across the country, across the world, in trying to find this balance of what do we do to keep the community safe, but at the same time recognizing the many impacts on the community. And from day one, the Board of Supervisors was saying to Chris, because we've been meeting with him every morning at 7:30 a.m., at least 3 times a week, just saying, from the early days, okay, we're sheltering in place, we're shutting everything down. can you bring an economist in the room? Can you have someone who can sort of balance the economic impact versus the benefit of what we're doing? And in the initial days, it really was flatten the curve. We don't want to end up like New York. We don't want to end up like Italy, where we do not have that capacity. And while many people think, oh, you know, in fact, back in March, and I will tell you the story when we decided that we were going to issue the first shelter in place, mandating people to stay home, we had this conversation that if we do it, if we're successful, people are going to come back and say, you just ruined our lives for nothing. See, nothing happened. We didn't need to do it. And so we've always recognized that that's going to be that undertone if we are successful. But nevertheless, I have no doubt, based upon all the models we were relying upon, what we saw in other communities, that we did save hundreds, if not thousands of lives by taking these very, very drastic steps. But at the same time, we did know there was going to be a devastating economic impact. You know, the ability to recover was going to be profound. And so we did in Contra Costa County, in order to move a little bit quicker than the state and even a little bit quicker than some of the Bay Area counties, we did a week and a half ago apply for and receive a variance to move faster through the state's timeline. And essentially the variance was an attestation of many, many pages, about 170 pages as I recall, just saying, here's how we believe we are prepared. Here's how we have sufficient PPE, how we have sufficient capacity in the hospital. We have sufficient testing, and even if we're not all the way up to the 2,000 a day that we'd like to be, we have enough testing that we can reach that goal based upon the testing centers that are available. We also have tracking in place so that we can accomplish that. And we have a stable or flat number of cases, hospitalizations. Now, when we did put in the attestation, you know, a week ago Friday, things were very flat and very stable. Had we waited 2 weeks to put in the attestation, I'm not sure we would have necessarily met those numbers, because we have seen such a recent increase. And so we always say to people, health officer orders, they are confusing, they are complex. We do have a hotline that is open 8 a.m. to 5 p.m. and we invite people to go to that. We also have a great website of frequently asked questions that is updated in large part by what are the questions the call center is receiving. My office, the other supervisors send in frequently asked questions that we're getting in our office as well. And so these are the indicators that I was talking about that we relied upon for our variance application. And then free testing, go get tested. This is when I was having my lovely test, which they said, hey, Candace, we're doing a press conference to get everyone to go get tested. How about if we test you? And this was before we went to the less invasive test. So this was the deep nasal, let's say nasal swab that went very high, not quite into the brain. It wasn't painful. It was just, you know, a little bit uncomfortable, but certainly not painful. And I tested negative, but we do have locations all over. You call 1-844-421-0804. You can get a free test. Your insurance will be billed if you do have insurance. You do need an appointment. Very, very easy to do. A couple of weeks ago, and because we were going to be around my elderly father, we had Phil get tested. It took me about 5 minutes to get the appointment for him. He just drove down to San Ramon. He, went through, and in our county labs, we are just doing the very gentle, not deep swab. At our walk-in clinics that are the state clinics, they are doing the deeper swab test. But nevertheless, if you have not been tested, get tested. It's helpful for us to know how spread it is in our community. And if you've been part of protests this last 2 weeks, encourage you to get tested because you were in much closer contact with individuals. If you have been exposed to anyone, absolutely get tested. These are just important parts of us having the full picture of how widespread COVID is in the community. And so talking a little bit about our congregate care facilities. This is where we worry the most about outbreaks. The Orinda Care Center, 29 patients had tested positive, 24 staff tested positive, 4 deaths. This was our first real outbreak. We, the county, don't regulate skilled nursing facilities, the state does. And when this broke out, we immediately went in to help them with best practices for, well, one, the testing, but also for maintaining the facilities. We really needed the state to come in to assist because so many of the workers were getting ill. Ultimately, the facility was able to bring in workers from Southern California and handle it themselves. But it was a challenging time. We saw the same thing happen in Carlton Senior Living, where we had 5 deaths there. And this week in Concord, another facility that we're not naming yet has had a serious outbreak as well, with quite a few deaths. And so we did implement several health orders that require our skilled nursing facilities to test regularly both the staff as well as the patients, to test patients before they come into the facilities, and really make sure that we're able to identify an outbreak before it becomes too serious. And then of course, most of these facilities you're not been able to have visitors as a way to keep the virus out as well. So we do have a dashboard if you're interested. On our website that shows currently there are 3 outbreaks, 1 being more serious, and total of 7 outbreaks that have been resolved. And this just gives you the day-to-day, how many issues we're having in those. This also shows you how many deaths, and given our relatively low number of deaths in Contra Costa, the fact that 29 were from our senior living facilities, skilled nursing, is really profound. It's one of the reasons we've spent so much time trying to work with those to ensure that we have some safety guidelines in place. And then the 27 hospitalizations is not to date, that's a cumulative number. And then this also just shows you the number of cases in total. We've had 237 over time. And homeless shelters. This is one where we've had great success. To date, 23 homeless throughout the county have tested positive. We've had 0 deaths. Currently, using some state and federal grants, we have 514 homeless individuals, and they're currently housed in 300 hotel rooms throughout Contra Costa County, where we reserve blocks of hotels. They're not just given a key and said, hey, see you later. They're provided supportive services, they're provided meals. We contract with some of our great homeless providers in Contra Costa County. And we're also working at the transition plan of when this is over, where do they go? How do we house those individuals on a permanent basis? Some individuals who are living outdoors did not want to come in, but even more importantly, in the early days of the virus, we wanted homeless encampments to sort of stay where they were. We didn't want police coming in and breaking them up because they were sort of like a household. They were already exposing one another. And so we were sending in our community outreach teams to work with them, to take temperatures, to determine whether anyone was ill. And then we were providing sanitation stations to any city that was requesting them. So Antioch, Martinez, Walnut Creek, Richmond, Concord, and Pleasant Hill all requested both the porta potties, the hand washing stations, to provide a higher level of sanitation for those. And we do have a dashboard on homeless testing and cases. And so actually my other one was dated. We've had a total of 51 cases of new homeless tests. I'm sorry, 51 new homeless tests, 23 cases. So I was correct on my previous slide. So 23 homeless cases in total, but we are making sure that we are testing this very vulnerable population, because more often than not, if they've been living on the streets in an encampment, they have other health issues that could make them prime candidates for a comorbidity. So many people who do pass away, it's either age or there may be another underlying condition, which we don't track. And this is something I'm asked a lot, and I've talked to our health officers about. We don't track with the deaths in our county whether there was another contributing factor beyond COVID. And they feel it's not a relevant statistic right now, and it would be very difficult to really keep track of that. Congregate care facilities include our jails. We've had no outbreaks, and that's because we've came up from day one a really good policy of not only did we really empty our jails, and I'll talk about that in a moment. But we also, at intake, if someone is brought in, they're quarantined for the first 14 days, and they're not exposed to the general jail population. They're monitored. They are tested at that point. And so 3 cases were identified in that intake phase. And so the sheriff, working with both the public defender, working with the district attorney, working with the courts, brought our jail capacity down to 36%. And so we have 2,000 beds, and we were housing approximately 695. This may have crept up slightly. The sheriff has not given us a report, but as of a week ago, that was about where we were. We had dropped bookings 84%. We were only getting 10 a day as opposed to 60 a day. And so we had the sheriff give us a list of, who was still being held, because we were still getting a lot of people saying, let clean out the jails entirely. No one deserves to be in that death trap. And so we had 164 who are in there who are facing murder charges, 98 facing child molestation, 22 charged with rape, 18 with kidnapping, 108 with robbery, 101 with burglary, and 186 assault with a deadly weapon. So individuals that generally you don't want to just have out in the community if in fact they pose a danger. And so those were the people who were staying in our jails. So we continue to encourage you to do these very simple things, because we really do not want to continue to see the spread. And do your social distancing, you're 6 feet apart, cover your face when you're out in public, keep washing your hands, and stay home when you're sick. And I'm going to just pivot slightly. If you have not filled out your census form, we really, really want you to do it. Census 2020 is here. This is something that is so important to us. It impacts our distribution of federal funds. And it's estimated for each person who's missed, we lose about $2,000 a year. And of course, census make up our redistricting boundaries. So for our Congress, for our state Senate, Assembly, county supervisors, and now many of our cities are shifting to district-based elections as well. And so important to do that. We have had a great census committee chaired by Supervisor Burgess. I'm the vice chair of that committee, but she's done a fabulous job. And currently our county response is 3rd in California. We have 70.1% of people have responded. California's response is 60.1%, and nationally about 59%. So it's an important thing to participate in. And because of COVID, we haven't been able to send out the census workers knocking on doors of people who have not yet responded. So we're doing a lot of other innovative ways to reach out to those who have not really responded. We have also early on identified hard to reach communities in Contra Costa County with over 50 different languages spoken, and working with different community groups, churches, others to really provide that segue into those communities to help them as well. And so David brought up, he said, we might ask you about Black Lives Matters. I thought it would be helpful just to give you, and this is not an exhaustive list, but an overview of some of the things we're doing already in our county to address racial inequality. And what I've been saying early on is, for us, Black Lives Matters isn't just sort of this hashtag, hey, let's be trendy, we're gonna say we care too. So I think probably one of the most profound things is our racial justice oversight body. And this was something that was started pre the last recession, where we looked at racial justice within Contra Costa County. And we saw a profound disparity in the representation of African-American, Hispanic, Latinos in our justice system compared to the population. And that report was kind of put on the shelf when the recession hit. We pulled it out about 5 years ago. And first we started a racial justice task force that again just looked at these numbers and said, what is going on here? And I could do a whole presentation on this as well. If, why are we seeing in our juvenile justice this, twice the number of Black youth in our criminal justice system as opposed to white youth, when the population of African Americans is only 10% over all of Contra Costa. So a lot of it, and what we're doing with our racial justice oversight body, is looking at what are the changes we need to be making, and how do we treat, starting with juveniles. And so we also have a juvenile justice coordinating council looking at that. And a lot of it is, how do we treat kids in school who misbehave. Do we suspend them? Do we call the cops? You know, what do we do with that? Or in other communities, are there diversion programs, which is something that DA Becton has been working on, along with some other restorative justice programs that can help divert youth from getting into the system in the first place. And we have, besides Juvenile Justice Coordinating Council, our county has had a hiring outreach committee that has been in existence for about 25 years. And yearly, we look at every single department, and they provide to this committee that I've served on. I'm not on it right now. I was last year. And it shows us in every department what is the racial and the gender population of that department. And we compare it against the county's gender population as well as the racial composition in the county. And we say, okay, you know, you're underrepresenting, you know, Asian women in this department. What are you going to do to increase your diversity? And so each department then has to come up with a plan of what they're going to do to try to raise that underrepresented population within their department. We have an economic opportunity council made up of individuals throughout the community to try to provide for additional economic equity in all of our communities, finding programs to assist individuals to pull out of poverty. We have a racial equity action plan that is being drafted as sort of an offshoot of our Justice Oversight Committee. And our Sheriff's Department does not receive military grade weapons or vehicles. Yesterday we did approve a search and rescue vehicle that's used as sort of the command center for search and rescue and storing walkie-talkies and things, but that's about the extent of it. And we have for several years really taken an approach toward de-escalating crisis events. And so we have something called MET teams, or mental health evaluation teams, where we have mental health clinicians who go out with police officers who have received enhanced training when there is an event where it's someone who is more likely than not having some sort of a mental health crisis and doesn't need to just be dragged in to a jail cell, but instead needs some psychiatric intervention, ways to de-escalate the crisis. We also have mobile crisis response teams, and we contract with community-based organizations to provide those. This is where you have a licensed mental health clinician, community family support workers, nurse practitioners, who also are able to go out to a crisis and intervene there. And all of our sheriff deputies do take 32-hour crisis intervention team training. We also have something that we adopted back about 6 years ago called the Stepping Up Initiative, which is really where you look at how we adjust our criminal justice system in a better way to intervene before people who have mental health crises and others before they get involved in the justice system. And so all of those things have really put us in a position to better address a lot of the issues that are coming out, both the racial equity issues, but the de-escalation of events throughout the Contra Costa County, as well as the whole Bay Area. So I always say my office is still here to serve you despite the COVID crisis. I do have staff members who answer the phone, who are in the office daily, and we're still practicing working from home where possible. It's something the county still advocates for, even though we are allowing offices to reopen. We think it's a good idea to continue that social distancing. And if you are not receiving my weekly COVID-19 updates, where I provide the latest and the greatest on what's happening, please sign up for that. And you can shoot my office an email, or you can sign up by going to the county's website. And now I am very happy to take any questions. I will stop sharing my screen so I can see all of you, and I would be very happy to answer questions or anything else you want. And I will pull up your participants list to see if I see any raised hands. No raised hands at this moment. Oh, but I see a real raised hand. Okay, Jody, go ahead, please.
Okay, thank you for a great presentation. That was very informative. I appreciate it a lot. You know, one of the things you had said was that at the beginning of all this, you guys were questioning whether to do shelter in place or